Okay. Hello, class. I'm Dolores Vela,
And I'm Mark Ondike.
and this is our descriptive epidemiology final project for Professor Klee's class in Epidemiology 587. And today we're going to be discussing end-stage kidney disease, the impact of social determinants of health on dialysis outcomes among African Americans. So just to start a little bit about me is I do work in skilled nursing. I've been working with older population since 2012. In my specific skilled nursing facility, we do have a dialysis unit that is partnered with DaVita. So picking one of these topics was a little bit familiar as I do have a personal experience as well with my dad having done dialysis back in the early 2000s. So this was just eye-opening because I didn't really understand it back then, but it's wonderful to get to understand it now.
Yeah, and my background, registered nurse. I work at a transplant hospital. We do transplants, so I've worked with kidney patients for a while now. I do a lot of coordination of their care from dialysis until they get their transplants.
Yeah. So we're going to get started, and pretty much we're talking about how this problem is not only affected biologically, but it is affected by social determinants. So how this affects outcomes. So while medical conditions like diabetes and hypertension are major causes, they don't fully explain the disparities that we do see. So the issue is not just clinical, it's tied to where people live, um, how they eat, their access to care, their access to healthy foods, their access to transportation, and other systemic inequities. So we'll start looking at some of the problems. Here you'll see that the prevalence of end-stage kidney disease is actually higher in Dallas County and pretty much Texas compared to the national average. That's pretty, that's great. And that's important that we highlight this because it's not just an isolated issue, it's a regional and systemic problem because we do see it across the nation, but pretty high in Texas. And so, pretty much these disparities, they're not, they are driven by standing inequities. Um, when we see individuals that don't have the right insurance, um, that leads to delayed diagnosis, delayed treatments, and so you pretty much end up on dialysis. And this leads to higher hospitalizations. I see it all the time, more complications, and pretty much a reduced quality of life. Um, so it's pretty sad to see. And then when we talk about the key drivers of these social determinants that are shaping our dialysis outcomes, pretty much access to care, like I said, when you don't get to the right doctors, or specifically whenever there's not the right type of doctors in areas, lower income areas specifically, it's hard for them to find transportation to get to those facilities. But that's not my topic. So, whenever you have access, a lack of access to care, there's delay in diagnosis and referrals to specialists, limited access to nephrology, and limited access to dialysis clinics. So, in practice, we see these patients, they were never properly educated about kidney disease. And so, whenever I go into these dialysis clinics and I talk to these nurses and I talk to these facility administrators, they say so and so's missed 13 treatments. And it's kind of like, why? Why have they missed it? Because they don't really understand it and they don't see how serious it is. and just other things, food insecurities and housing instability and financial stress. Those are also key impacts, key drivers that impact, these outcomes for dialysis.
Yeah, so in addition to those challenges, we do have transportation barriers. And like Dolores said, this leads to missed appointments, or sometimes they have to shorten their health sessions. Because these are treatments, usually they are assigned a specific amount of time that they have to be completed. So if they need transportation earlier before their end of session, so they end up leaving and they don't complete the treatment.
Really
Uh,
quickly, too, I just want to add, Mark, I'm so sorry, but as people are missing their dialysis treatments, that dialysis clinic won't see them anymore. And so that leads to more referrals and having to find another facility that will accept them.
yeah, exactly. So, and eventually this leads to complications, as I was alluding to, um, as well as, limited education, which Dolores talked about. All this goes, you know, um, down to education, education, education. So another gap we do have see is reduced access to dialysis, especially in these areas. Or, majority of the population is African Americans. So what is the impact on all this? So at the end of the day, this does have an impact on the outcomes. So, with that, later dialysis and increased hospitalization and lower transplant access, which increases, mortality rates. So let's look at the interventions and implications this has to this population at the national, state, and local levels. So for the national level, we do have value-based care models. So these models, it's actually based on CMS, which is Medicare pays based on the facility and the performance. So QIP means quality incentive program. So the better outcomes that clinic has, it's best tied with their payments from Medicare. So we need to expand insurance coverage for all and adjust policies, especially to address the social risk factors. So at the state level, here in Texas, we need to expand Medicaid to reach these patients because they are at risk or vulnerable. Increase transportation support programs. I know some companies do provide that central locations where they have buses that can transport patients to the clinic and back, and also offer financial assistance initiatives, things to help with, co-pays for their medications, food programs for health nutrition and stuff like that. And at the county level here in Dallas, we need to make this a community-based program. I know a few that provide, food. We need more patient navigation services. These are people or healthcare providers that link these patients to services to link those gaps. And then also, of course, education that's tailored specific for this population. So the goal of all this is to prevent rather than, get the disease first. So we want to early chronic kidney disease detection, lifestyle interventions, and improve the healthcare literacy.
Yeah. I agree. I think that these disparities, so they're not just medical, they're social issues. And when we address these social issues, like access to transportation and education, I think once we can get it, especially I really like the point where it says culturally tailored education, especially from the Hispanic community. You have those language barriers. I think that's so important. And I think that when we start with these preventions, I think we can see a bigger improvement. This will be where our YouTube link will be. And these are our discussion prompts. So the first discussion, if social determinants like transportation, access to care, and socioeconomic status are major drivers of dialysis outcomes, should healthcare systems be held accountable for addressing these non-clinical factors?
And the second one, which interventions would have the greatest impact on improving dialysis outcomes? Expanding access to care, improving patient adherence through navigation programs, or addressing social barriers like transportation, and why?
These are the references that we use specifically for our symposium poster. And we want to thank you for a wonderful semester. I'm Dolores Vela. This is my email address if y'all have any further questions.
And I'm Mark Ondeke. This is my email address.
Thank y'all so much.
Thank you.